Welcome, ladies and gentlemen, to the podcast of Action Require Media. Here we educate, entertain, and empower. Also, we are dedicated to discussing hard truths and finding remedies for our problems. On this platform, we will stay engaged on all happenings in Mama Liberia, not limited to politics, religion, development, economy, security, crimes, war on illegal drugs, employment, youth, growth, and food production. Ladies and gentlemen, you are watching and listening to Action Require Media. Once again, we educate, entertain, and empower. Please like and share our show. We'd like for you to comment. Uh, Also, if you want to be a commentary on the show, please contact one of us and we can bring you on. Again, before we go through our introduction, we'll have an opening prayer, and that will be done by our new brother here today, Brian Sly. Mr. Sly, can you give us our opening prayer, and then we'll go into our introductions.
Let's bow. Our most gracious Heavenly Father, we thank you for this opportunity. We thank you for the time you've given us to come and discuss issues affecting the life of our country and its people. We pray for wisdom. We pray for understanding. We pray for even the people who will be listening here and after, even live or later on today, that Lord, whatever is going to be discussed will be people will hear it and be able to see how best we can move our country forward. Thank you. In Jesus' mighty name we pray.
Thank you,
Amen.
Brian. At this time, gentlemen, we will go through our introduction, and at this time, we will start with Dr. Ajibobi Water. Dr. Water.
Yeah, thank you, CEO, and good evening, everyone. I hope you had a wonderful Sunday today. It's a great pleasure to be here again. And thanks, CEO, for the opportunity again. I'm looking forward to the discussion today. I hope that those of you that are following, you can send us your comment. If you can, please share our show and just let us know how we can better improve our platform. Again, I'm looking forward to the discussion and thank you for following and sending us your comment.
Thank you, Dr. Water. Appreciate that. Also, at this time, we have one of our newest brother who just joined us, and I think a lot of people who know Brian um, recognize that he comes with a lot of weight and power. They call him the giant. But at this time, I will let Brian to introduce himself. Mr. Sly, please introduce yourself.
Okay, my name is Brian Sly, hail from Liberia, and I started from the Liberian film industry as a writer, a script writer, and a movie director. Something that led me to the United States. I'm a father of four, a student, and a leader in my church, and I'm happy to be a part of this endeavor. Thank you for having me.
Thank you, Brian. Appreciate that. Um, so, and my name is Brother Joseph Brown, and I'm your host of Action Require Media. So, gentlemen, let's go through the topics. I know the topics is pretty intense, but what we can do, we're gonna do section by section. So today, we're gonna be discussing healthcare in Liberia and its challenges. We recognize that there are about 127 hospitals in Liberia. Okay, now on the current event, we want to relate to what happened when Ghana took her citizens from South Africa. So, how do you see Ghana's decision to remove her citizens from South Africa? Should other countries do the same? So, these are topics that we're going to be discussing. So, firstly, we will want to go through some discussions of our healthcare system in Liberia. Now, first of all, we want to identify what kind of a system we do have in Liberia and is affordable. Does it meet the criteria for quality health care and delivery services in Liberia? Now, we let's look at one of the main primary hospital in Liberia, the John F. Kennedy Medical Center. So this is the largest medical facility in Liberia that uh, provide healthcare deliveries and training services for Liberians. And also, this institution has about I think 500 beds available to serve Liberians. And also, we're gonna be discussing funding of this great institution. I think this building was built in, I think, in the 70s or something like that, but it is a unique building, modernized structural building at the time, and it still looks good. Um, but before we delve into this, let's look at types of healthcare system around the world, and then we can discuss what system fits Liberia or what system Liberia is practicing, and then we can go from there based on our research and discussion here today. So again, um, it has been recognized around the world there are about four major healthcare systems. Okay, that based on um, affordability and services rendered at that facility. So, wherein you will look at the universal coverage with single payer system, and we also look at the multi-payer system with no universal coverage, and then universal coverage with multi-payer system and no national health care infrastructure fully out of pocket. So out of these four systems, um, we going to figure out, or we're going to talk about what Liberia's healthcare delivery system looks like, and also we can. If we don't have the time, but what we're going to do, this section is going to be broken down into parts. So right now we just defining the healthcare system in Liberia and the deliverable. Now we can talk next Sunday or next time on what services are provided and how much it costs. So today we're going to be talking about funding and also delivery type of healthcare system. So Dr. Wallow, Brian Sly, anything you guys want to cover on this? Anything you guys want to touch on before we start talking about um, the type of healthcare system and which one is Liberia major system?
Yeah, okay. Thank you, CEO. This discussion about healthcare and healthcare delivery in our country, it's very important, right? I think we have had a series of conversations around this issue. I can't really tell you what kind of system Liberia uh, has currently. But I want to believe that we are not practicing anything close to universal health care. At least you talk about single payer or multiple payers or stuff like that. Look, the challenge we have in Liberia when it comes to healthcare and healthcare delivery, is just multiple, right? Because healthcare is not just someone showing up at a hospital, right, and getting treated. There are multiple layers to healthcare and how healthcare is delivered, right? You have to have the infrastructure, you have to have the personnel, you have to have the management, you have to have the leadership, you have to have the logistics, you have to have the affordability aspect to it, and all of that, currently all of those elements are a huge challenge in Liberia. Liberians, number one, don't have jobs for them to have a stable income to be able to afford, healthcare expenses when they need to. So the entire system in Liberia is just so challenged that it would need a serious attention, not just from government, but from private investors. Now, the challenge the JFK and other institutions have is that there is not much money given to those facilities, right? So they have a huge budget. Just imagine Morovia alone has about at least 1 million people living in the city. Okay. And GFK being the number one referral hospital, it is a huge challenge for that. So the government need to diversify healthcare. We need to decentralize it, so that other health facilities will be able to absorb people that need healthcare delivery. But if it is a challenge in Moravia, in Moravia, the capital city, just think about the leeward counties, right? It's a huge challenge. So, uh, yes, people might think that we are making some improvement, but we are still far away from where we need to be as a country. And lastly, that's why I get so concerned when there is a rumor of epidemic like Ebola or coronavirus or any the hunter virus and these kind of viruses. So because it is going to be detrimental for our country, because we really don't have the facilities that can really contain those things. But thank God that from our experience from the Ebola, the NFL and the Ministry of Health were able to put some things together, that can be a very good startup for us. But we really need to focus on healthcare. We really need to.
Okay, uh, Mr. Sly.
Yeah, one of the important aspect that I want to for us to take a look at or to actually observe is the World Health Organization, in terms of mandate given to what it entails for a country, to contribute to its citizens' health. And they actually said, in that document, they talk about 10 doctors to 10,000 individuals. So if to have 10 doctors, the 10 doctors will be able to cater to 10,000 a person. So, but if you look at the entire our country has approximately 298 doctors. So, and compared to a population of 5.5, if you look at that, the vast, if you look at the margin is you probably looking at one doctor to 15 to 20,000 a person. So if we must be able to deliver health system that will be able to be that will be compared to any other country, and if from the statistics, Liberia is one of the lowest in the entire world in terms of professionals, be able to deliver health to its citizens. So I think the best thing we can do is for Liberia as a startup is to see how best we can have institutions, institutions that of higher education, where we will be able to educate people, who will be professionally trained in terms of the doctors and nurses, physicians, and midwife and stuff like that. Continue to educate people, and the only thing to be able to do that, you need institutions, reputable institutions being established to be able to educate people, so that at the end of the day we can have professionals. The reason why people will literally leave Liberia and go to neighboring country like Ghana and the rest of them is because we don't have, apart from not having the labor, we don't have the institutions and the infrastructure and the facility needed to be able to cater to people. So you find out that people will have to go to on the neighboring country to to better up their life, because at the end of the day, even if you follow the statistics, you find out that countries like more I think what is the country Mauritius, I think countries like Libya, Tunisia, these are countries that actually, a little bit closer, to that number of doctors per, a number of X amount of people. So the institutions need to be really, really, we need to, Liberia need to see how best we can. And the way we play with our educational system too is just laughable, yeah, because you have people going to medical schools, and you literally see people, like playing with human life, and it will be buying grades and stuff like that. That is, it's sickening, so again, like major point I want to stress is that we need to have countries, we need to have an institution that will be able to establish reputable institution to train people. If we can't train people there, let's send people out of the country to train them and bring them back, pay them well, like every other country is paying its doctors and professionals, so that at the end of the day, we can have the people stay in Liberia and be able to contribute.
Okay, thank you, Brian. So if we look at the JFK as being the major and the largest facility of healthcare deliver delivery in Liberia, we must recognize a time when JFK was built. The hospital was not built to um, facilitate the growth of the population we have had now. So again, other extension of hospitals should step in and be well funded, even if it's private or you know government owned hospitals. We need these facilities as well. But on the other hand, we like I said, we're gonna have this in sections. Okay, so basically, we're just having a pre-discussion on how we're going to structure moving forward with healthcare, because healthcare is bigger. We have the administrative part of it, we have the delivery part of it, we have a lot of systems, and we have to discuss those things in parts. But I'm sorry, the topic was posted late. But if you look at the system in Liberia, we would say the healthcare system in Liberia is out of pocket model. Okay, so the out of pocket model, wherein citizens have to pay directly out of the pocket, it's not more advanced like um the Western world, where you have insurance or maybe tax deduction coming out from employees that facilitate the medical health facility that is owned and controlled by the government. Now, Liberia, the JFK is mainly funded by the Liberian government. Okay, let's say based on the allocation of healthcare budget, I think the government of Liberia needs to do better when it comes to health in Liberia. Because the better you treat your people, the longer they live and the smarter they become. And then we will be able to battle epidemics and other viruses or sicknesses that might come into the country. Like you said, per doctors to citizen treatment method, we have not met that criteria yet. For a whole nation to have only 290 plus doctors, that's a problem. It's concerning. It is very concerning. So now I was reading this research. So let look at this. There's JFK has. Um, Let me put on the screen real quick.
Why you looking for that, CEO? Can I just
Yeah, go ahead, Dr. Go
say
ahead.
something quickly? So look, the why it is a challenge, right, to us as Liberians or as a country developing, a very good uh, healthcare system or healthcare institutions that would be able to cater to the citizens. Why it is a challenge? There are just things that we can do I can also help, right? And to be frank with you, I think most Liberians are doing some of those things. That's why you don't see people get sick to the extent, of emergency, because they are doing some of the things. I'm talking about preventive
Preventive
measures.
measures. Hmm.
Yeah, things that we can do that would stop, disease or illnesses, or problems before it even happen. Those are things that we can do, even if hospitals, right, don't have the equipment, they don't have, what is needed for them to be able to deliver the kind of services they want to deliver. Just providing information on preventive measures, that alone can help the citizens, right? Because some of the things that we will need to do to prevent diseases or illnesses from affecting us, you don't have to pay money for it, right? Like for example, washing your hands, right? See, can you bring about? Let me be looking at
Yes,
you guys.
sure.
Like for example, uh, you know, when I was in Labrador, we all did it, and we did it out of ignorance. Okay, you would just step right outside, right side the road. Maybe you are going, to a school, you're going to a church, or you're going. So you just step right side the road and you pee, right? You urinate, okay, and you don't wash your hands. You go and touch food. Look, when I went to Liberia and I see people doing that, it kind of gripped my skin, right? They would be selling in the street, but just leave their business. They just walk right side the road and urinate. Both men and women do that, and then they will come right back to the food that they are selling and touch it with their hands, unwashed hands. How people wanna get sick from that? You know, just common thing like washing your hands regularly, right? Majority of the things that people suffer from in the country is malaria or typhoid, right? Mosquito net in the country is very cheap. Okay, I know there's an issue with electricity, but why not use mosquito net? Okay, why not use mosquito net? I can't talk about regular checkup. Just going to the hospital to just do a regular checkup. You know, Liberians go to hospital when they are lying in bed and they cannot wake up. That's when they go to hospital. We don't go to hospital to prevent ourselves from getting sick or to do a checkup or a regular checkup. We don't do that. And I think one of the reasons people don't do that is because people cannot afford it, right? But there is a way the government can sometimes subsidize some of these things that will just bring, that will help, the healthcare system, since we don't have sophisticated equipment in the country. Those kind of simple things, eating healthy, physical exercise. Our country is a very young country, a lot of young people in the country. Just exercising regularly, safe drinking water, these things, good sanitation. These things are things that we can do with no we you don't have to pay money for any of them, right?
Okay.
So there are
So
things that we can do that can keep Liberians healthy, that don't require a lot of money. But
okay.
if we are waiting to get these hospitals or these institutions uh, equipped before we think about healthcare in a holistic way, then a lot of Liberians going to suffer and die when we can just provide basic information. So hospitals can just provide basic information to the general public that can really help a lot of people.
Okay. That I want to thank you. So, well, at times we might think these things are simple, but if it's not been practiced from a younger age, it's not going to be a part of you. So that's where institutions
Fair
like
point.
school, yeah, school, like nursery, high school, and there's a public health awareness, the media coverage, television. These things need to be done on a daily basis, so the newer generation can understand the importance of washing your hands. But we need to take a lead in this to I rather prevent than to try to cure something. You know what I'm saying? Because it may not be always positive outcome when you try to cure something. So, but let's look at this.
Yeah, and see, oh, my
Yeah,
brother going to come in, right? Yeah, you are right. You know, preventive measure is very important
yeah,
to prevent people from getting sick. Okay, because people don't want to get sick. When you get sick, you either hope to survive or to die. People don't want to get sick. People don't want to die. So we have to practice preventive measures. I think that's going to help our country a lot. Because
okay,
every time we talk about healthcare, we want to focus on the treatment, okay, or
yes,
how people can get killed, right? We don't usually talk about prevention. Okay, prevention is the better. It's a better care. In fact, that was the reason hospitals were established
yeah,
to prevent people from getting sick, not to get sick and go to hospital, to prevent
yeah,
people from getting sick. And I think we need to practice that as a country.
yeah.
We need to practice that. Even though,
Okay,
yeah, it has not been part of our orientation, but that's going to help a lot.
okay. Okay. All right. So I just want to put on the screen. I think sometime this year, JFK, as you can see the topic on there highlighted, JFK Medical Center unveils 132.8 million overhaul for significant funding gap. Now, if you read this piece here, it talks about the importance of modernizing JFK from paper trail to digital trail, where they will keep all those documents that have been there from in the 70s. They can transfer them into a digital format where it can be easily accessed rather than paper trail. Now, so based on this, so this campaign was named as Reimagining Excellence. So it says a new era for John F. Kennedy Medical Center. So this plan here is over the span of 5 years. Okay, it's over the span of 5 years. Now there are a lot of good things in here: infrastructure, all right, renovation, staff development, equipments, technical skills, and other stuff. I hear now. The government of Liberia only allocated 9.5 million, okay, to JFK, to the healthcare system. Well, over 5 years. Now, and they are requesting 132. So we saying that the government of Liberia is not funding JFK the way it should be. So JFK is a government institution, even though the prices there for services are affordable, okay, but there are some that are uh, not affordable for common people. Okay, that's we will go through the prices for services at JFK on another show. But let's see the need here. So these medical professionals at JFK are seeing the need for a transformation of JFK to be able to provide quality care on a daily basis for its citizens and foreigners, or people who just want to go to Liberia for healthcare system for healthcare treatment. Now, we will need, and it's a must that we have this transformation in the country. Now, let's say the government. Let's look at the USAID. USAID were funding JFK a lot, but since USAID has been pulled from Liberia, now we don't know how much JFK make on a yearly basis. Okay, we cannot estimate. I tried to Google it, but they keep the internal statistic to themselves. It's not public. Okay, but the information to put out there that people need. Now, those people who were saying that JFK doesn't need any uh, renovation. This is actually a factual documentation here saying that JFK need to be remodeled, renovated, and will be and needs equipment. Okay, now I don't know if you got heard during the campaign time. Um, let's say under the CDC government, okay, a new lot of hospitals were being built. Okay, instead of building those hospitals, those money could have gone into some of the things Brian Slow was talking about. Okay, uh, uh, developing the country major hospital, like providing X-ray machine, um, you know, laboratory, scans, and even taking some of that money to sponsors uh, students who want to be doctors, and come to the facility to be able to help. But they play too much politics with Liberian health. Now, this is actual fact that Liberia GFK can be renovated and remodeled in a sense where it just need the funding to be able to work to a maximum potential. Okay. Again, um, we will have time to talk about this issue, but I think funding for JFK is a serious issue that uh, could be the reason why we don't see the outcome we wanted to see from JFK um, delivery services. And again, it could also be the um, how much is being paid to staffs there to work there. All right. So I think it's important for us to to recognize that the kind of a system we have in Liberia, even though it should have been sponsored by the government, but we don't have an insurance pay model where insurance is coming out of worker paycheck every week or every month that goes towards the hospital or healthcare system. Now, the system of out of pocket model is good too, but then if you have a private institution who is mainly based on out of pocket model, those people provide special services. Okay, but the services are pretty expensive for normal people. That's where in JFK kicks in as a nation hospital to be able to have to make to be able to make healthcare services affordable for a citizen. Again, I would say that JFK, if there's a way the Liberian government can provide this money for JFK, we should provide it because health is very important. We don't. This might go into also preventive measures. Okay, this might go into child development. And a lot of stuff. But again, we at a standstill. The more we play politics in Liberia, the more we're going to endanger the future of Liberia.
Yeah,
Brian.
I want to comment. Yeah, when I read that document, about $132.8 million needed
Yep.
to revamp the entire JFK, which is a very good initiative for the next 5 years.
Yep.
And then when I kind of realized that if you look at the national budget for health system in Liberia, it's approximately $110 million.
Okay.
$110 million, and for 5 point some more million people. So, but I don't want to focus so much on what the government can do. My point I want to stress is what is it that Liberians can do. Liberians, most especially in the diaspora. I remember when I live in Ghana, you found out that at a certain point in time, the government opened, extending their help to Ghanaians living in the diaspora to come down and help revamp the country. And once that system was opened up, Ghanaians from all over the world, Germany, Netherlands, went all when they started to pump, go into, to help the country. Today, Ghana, look at the time I left from Ghana 2006 to the time I went back 20 last year. Ghana has massively. improve. So my thing is, what is it like? Yeah, then so the national budget of Liberia, if you look at it, it's just a minimum budget. So and out of that budget, 110 million is directed to the national health for the entire country,
Yeah.
and JFK is asking for 132 million. 132. So what I think Liberian diaspora can do is when I'm doing the statistics in terms of how many people, how many Liberians live in the United States, we're pretty close to over 100,000 Liberians according to the census that I read. But if you even go, if you want to broaden the definition of Liberians, typical Liberians, and then the American Liberians, you're talking about or 250 to 500,000 that live in the United States alone. So let's say we see we understand that the health system is very vital. Yes, indeed, it is vital because we understand we live in a country where we regularly, go to hospitals and some of us will go to the hospital. They even say, "Oh, the bill we don't even care," and stuff like that. Bills are paid, and at a certain time, the bills just go away. And some people don't, we're not conscientized enough to know that, oh, that I have to pay this bill, you know. But it's just, so what is it that we can do as Liberians living in the diaspora to be able to help such initiative? Let's assume, let's assume we are just 250,000 in the Liberians in the United States, just in the United States alone. I'm not talking about Canada. I'm not talking about the Norway and the rest of it. Let's say 250,000 Liberians in Liberia decide to contribute $100 into a specific account for the health system in Liberia. Do you know how much that gonna be?
It's gonna be a great amount.
That will be a great help.
Yeah.
That will help, to also, help the government. And if we can find a way, that we can have, because we don't want a tendency where you will contribute the money and go into someone else's pocket. You don't want to do that. So the government will formulate a system in a way that maybe a particular agency that will be responsible to be able to understand, and say, okay, to understand, and say the USA, let's know how many people in the United States, in Canada, in the rest of the world with Liberia, and see how they say we can get in contact with them to be able to contribute the so to a specific account. That money will be able to help in specific sectors that we want to help, Liberia, instead of just fully and wholly government. What the government can do, what is it that we can do as Liberians? That is the drive, because I went to JFK 2021 and 2021 when I went to Liberia, and my aunt husband was in the hospital, and I went to visit JFK, and I got to JFK, man, I almost suffocated. I almost. I was like, what? So, even because even the cleaning of the hospital, right in Liberia, we're talking about jobs. Oh, we will need jobs. We need job. We need job. When even creating job, just the hospital alone, by having a cleaning team, that a private entity that would just be responsible to clean all the hospital in Liberia. Do you know how many jobs we're going to create? Do you know how many jobs we're going to create? So all of these things, these are things that none that we don't necessarily have to be in government to do that. As citizens of Liberia, it's something that we need to start to think about and see how best we can be able to help and make sure that we contribute our own quota, despite the fact that we're in a foreign land. We can do that. Yeah.
Thank you, Brian. Dr. Water.
Brian, that was beautiful. That was great. Then that's a great suggestion. Here is the issue with it, and I think you mentioned that in your expose. Librarians don't trust the government. We don't. You see, Jackie is asking for 132.8 million dollars. I am of this. I am of this principle. I'm of this belief that if you can manage little, you can manage much. If you cannot manage the little that is given you won't be able to manage much. JFK, the administrations that have been at JFK, they have never proven that even if a lot of money is put into this institution, it can become better. For me, I don't think JFK problem is money. I don't think so. I think JFK problem is leadership and management. Because here you, Brian, here you on a talk show asking Liberians in the diaspora to at least think about helping their country. You think Liberians have never thought about that? Has the government asked Liberians to do that? Right? Has your government asked you that we are hugely challenged as a government? We want our citizens in the diaspora to help us in this endeavor. And here is, these are the things we have, outlined. When you contribute, this would be the benefit, or this would be something that you can benefit from your contribution. The government have never done that.
Or this is how the money is going to be used.
Or this is how the money is going to be used. And we can, we, we can assure you
Transparency will be there.
there will be transparency, and whatever that is contributed, people are going to know about it, and it will be used the right way. And by contributing, this would be the incentives, right? Just to encourage Liberians to do that. The government has never done that. Look, if you have a very good leadership, $132 million should be nothing for JFK to raise. They don't even have to ask the government to do that. Okay, JFK national budget is between 15 to $20 million a year. Okay, and 132.8 million, you are talking about 26 million a year.
Yeah.
JFK can raise that in a year. People go to JFK, they go there and they don't get free services. The money that is being paid to JFK, what do they do with it? What is the accountability that someone will trust, Liberians in the diaspora will trust and say, when we put our money in this hospital, our people are going to get the dividend of it? There was this country. I was just thinking about it. It just couldn't come to my mind, right? The citizens built the first national university. There was this country in
Oh,
Africa.
yeah. I know talking
I
about.
know.
Was that
Yeah.
Uganda?
No,
Hold
it's
on.
not Uganda.
Hold
I know
on.
it's Zimbabwe or one near country. The citizens built the university, and because the citizens built the United built it, sometimes some people contributed cows, maybe 5 cows,
Yes.
maybe 2 cows. Because the people built that university, their children are attending that university free of charge. If Liberians were to do that, what would be the dividend for Liberians' children? What would be the dividend for Liberians at home? If the government can come up with something that will encourage Liberians in the diaspora to say yes, okay, this is new, this is reassuring that if we invest in this is the steps the government going to take. I'm telling you, I have never met any Liberian that hate their country.
It's
Liberians will contribute to
Botswana.
that. Botswana, okay,
Yeah.
Botswana, yes. Liberians will contribute to that. The idea you proffer tonight, Brian, that is brilliant. We just don't trust our government. The money gonna go in someone's pocket. The corruption in the country is so high that people don't trust people. Can we trust our government to say that if we invest in that, our people going to get a dividend of that? No. The answer is no.
That the Waller and Brian here. That what I would disagree with you on some extent. The fact that GFK problem is not money. I think um it may not be 100% finite, but I would say that could solve um delivery services rather
Yeah.
than
CEO,
people not getting quality care.
let me clarify what I meant by
Okay.
that. Okay. So when I say JFK problem is that money, JFK problem is trust issue,
Okay.
right? The little they have gotten, I'm not saying JFK has the money they need for them to build the infrastructure they need, but because JFK have not been managed well, because they
I
have
get
not
that
been
point.
managed well, so nobody's going to put their money in that.
But, so
If JFK was managed well, right? If JFK was managed well, you are going to, in fact, you could have even gotten a private investors.
but that the Waller,
JFK
that the
could
Waller,
raise money over with no time.
that the Waller.
Right now, you give JFK the money they want. I'm telling you, the next 4 years we'll be talking about JFK being the
Let me
same. I'm
let's say
telling you,
this
I
right.
can
I know
guarantee you that.
next Sunday we'll bring out the fees afforded at JFK, and you will see that there is nothing going into JFK for services. Okay, um, if somebody's going in for admission and you're paying $5 or $10 for admission, let's say you see about 200 people in a day. Okay, how much is that money? Okay, compared to the value of what the money is now. Okay, you will say it's nothing compared to the services you're gonna get.
Admission is $5 at
No,
JFK.
no, no, no. I'm just saying. No, I'm just saying. Some areas
I'm
because
gonna tell you who lying to you like that. So
oh no, 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 no. I I posted it on a group chat. You will see it. But what I'm saying, I don't know about it, but they have age range from 0 to 4. Okay, your admission is free. Okay, but if you want to get labs and scan, you will
that's not
pay
true.
up to
That's not
this.
true.
It is true. That's what on the services price
That's
thing.
not true.
But
It's
that's what
possible
on
to say
that's what
that
on there.
But it might be written somewhere, but that's not
Okay,
what the
okay,
practice.
okay. So what happened here is, like I say again, I will bring it next Sunday. We'll discuss it, and I'll send to the group chat, and we'll discuss it. And that's the reason why I want us to discuss the in depth. So we have portion that we take in up apart and put them back together. We want to know. We want to understand why services are not being at its quality level at the major hospital in Liberia. Brian, your statement was you're fine. That the water cool, but that's just one major hospital in this country. That hospital should be funded to the maximum. It has the largest bed in the in Liberia, 500 bed. Okay, so I think that hospital should be funded fully so it can work at its maximum potential. But
What
again,
would be the amount needed for it to be for JFK to be funded fully?
so I'm not there in that department or capacity to say this how much you need, but what they have recommended over 5 years, I think it should be given to them. Like Brian said, you just said that the Wallow. Let's leave it if it's not a trust issue or not. If Liberians in America here, if we want to start an initiative to help cut down costs or to bring down some of the recommended amount for JFK, we can start an initiative, like Brian said. If action require media want to start it, we can put out our memorandum, we can put out papers, we can start going out on
Yeah, but it will not be for JFK
why.
because the government got more money than us.
That's
The
true.
government has more money than us. The government money is Liberians' money.
So then let
Hold
the
on, hold
government
on, hold
fund
on,
the let the
hold
government
on, hold
fund the
on.
institution
The government money, the government raise taxes from us.
and natural resources.
The government controls the natural resources, which belongs to Liberians. The government, the government has Liberian people money. If the government believe and value Liberian lives, Let them take the first step. Let them be the one to initiate something like that. It shouldn't be Liberians. I'm telling you, if you ever initiate something like that to JFK, it's going in someone's pocket.
But even if it
I
goes in someone's
guarantee you
pocket
that.
at the water, I think this is what I see, right? The government will not find it important to look at things that are necessary for the country to grow. They will always depend on the American Liberians in the diaspora. So if we do it one time or two times, they will expect more. It's almost like job creation. They're not trying to create job in the country, but because they know that the remittance going to Liberia is taking care of maybe 50 to 70% of the population, and that's just that's just the fact. So again, look, the government needs to step up and do what it's supposed to do, and especially JFK need to be funded. All right, we have preventive measures, and like I said, next Sunday we'll come up with some uh fees, uh, to
I
access.
see. Oh, you said initially you said 127 hospitals. Is it
Yeah,
in Morovia or in Liberia?
it's in the entire Liberia. It's
Liberia,
estimated.
okay.
Yeah.
So I know I
Moravia,
know they
Moravia
have
has.
government hospitals in the various counties. Uh, you get redemption. You get redemption in Morovia,
Yeah.
right? You get 14 military hospital in Morovia. Wow, we're not talking about the other hospitals, but
But
JFK.
but JFK is the number one hospital, okay, and
Yeah,
it
they
has
used
the
to be.
maximum.
It
But it
used to
still
be.
is. It still
It used to
is.
be. You know how people used to call JFK just for killing.
Yeah,
JFK just living on past glory. JFK
yeah,
is
but
badly
Dr. Wallo,
mismanaged.
Dr. Wallo,
The
if we live
hospital is
on past glory,
mismanaged.
if we live on past glory, there's a potential. There's a potential to go right back to where it used to be, or even more than what it used to be.
Now you see now you coming to me now. What I said that money is not an issue for JFK.
But no, that the word I would say money is the
Money is
issue.
not an issue.
Because if you pay these people well, and you have quality equipment, we do not have to travel. Let's say, for example, out of pocket cost, right? Let's say a senator would need a scan, a PET scan or MRI scan, who goes to Africa to pay $5,000 for one scan, right? If we do have that scan at JFK, he can go to JFK and pay that $5,000. Then you will understand that the healthcare is making money. But if we don't have those machines and the quality, the services there, these people are gonna go out.
uh, CEO,
Yeah.
you want to tell me that JFK is so broke that JFK cannot afford to buy a CT scan? Is
And
that what
like
you're
I
telling
said,
me?
we're not into the internal
The
financial.
place is very, very mismanaged.
I mean, I will
And
agree
that's
with you, but
mismanagement.
so we will come to the management part of it. But let's just we'll get to the part. But I think funding is necessary for Liberia. I mean JFK, Brian.
Yeah, Dr. Wallow made a very salient point that no matter how much money we send into any institution, if we don't have leaders with integrity, we're just wasting our time. And I think one of the major issues Liberians have is having people who who you know who fear God, and because you fear God, you do the right thing. And that country, Edwin said it the other day, and because of how we in the past how we behave in the civil crisis, it just made us to be wayward and backward, and we don't see to see people who actually who become fear for God, and because they fear God, they want to do the right thing. It's just hard. So again, he made a very very important point. Even if government take that 132 million to the, even if like NGOs do, the US used to contribute to those kind of thing and stuff like that. You see money pumping into those sectors. Even if money is even invested into this thing, and you don't have leaders, people who are leaders leading those institutions with integrity, they're going to invest all the money and put it in the pocket and get enjoy themselves and be having 2 to 3 girlfriends and all what they play, be buying baby car and giving them small getting all kind of thing and it's pathetic. It's frustrating. So where he's going, I understand that, but again, we still need to do something. We still need to do something. I'm sorry that I have to let you guys. I have to go because of some emergency right now. But this is very important. The topic is very interesting, and it's something that we really I don't know. Sometimes when you look at library issue, you find out like how is it that we can actually what is it that we can do to make Liberia better again? And when you think ahead, sometimes the thinking can even make you have headache because our problem is so much, and
Yeah,
we need
and
people.
Brian, it was nice having you. I hope you come again. Liberia's problem is all of our problems are human problems. They all can be solved. We just need to be serious of solving them. There are solutions around all of the problems we have. We have to be intentional and we have to be serious of solving them. But we don't solve problems. We create problems. Okay, that's why you see the problems we have now, they have been compounded because we're not solving them. Problems don't solve by themselves. People find solutions around problems and solve problems. Okay, that's what governments do. That's what leaders do. They solve problems, but we don't have problem solvers. We have politicians, but we don't have problem solvers.
Wait,
Talkers.
And that is the issue. You see, they see, Brian, it was not having you. See, let me tell you something.
Thank you, Brian. We'll see you next Sunday, bro.
Yep.
All right.
See, let me say this. Okay, JFK does not have money problem. They think they do, but they don't. JFK has management and leadership problem. Okay, that is what is going on at JFK. JFK is very, very mismanaged. You put 130 some odd million dollars in JFK. 3 years from now, we'll still be talking about JFK problem because money is not the issue. Money has never been the issue. Management is. You resolve the management and leadership issue at JFK. JFK would be a vibrant hospital, a hospital that cares, a hospital that gave people dignity when they are sick. They are not treated like animals. Okay, so money is not the issue. I don't want us to convince people that JFK problem is money. I disagree with that. The reason they're having the money issue is because of the leadership lapses they have. Okay,
All right.
resources is attracted to vision. Resources is attracted to innovation. If you cannot innovate, if you don't have a vision, resources run away from you. And that is the same problem Liberia is facing.
All right. So Tata, well, let me ask you this question, and I just want to get your take on it. So, do you think building more hospitals in Liberia is the answer here?
What they want, the ones we have, what are we doing with them?
But that's what I'm trying to drive at. All the news hospitals that were built under George
Yeah,
Weah, uh,
I think President we have built two or three different
the Emory
hospitals
Hospital
or
and
more.
the military of what the 14 Hospital. Look, I personally think, right? Don't get me wrong. A love for nation should be above self, and the reason why I say this, most people in leadership at times when they are president or in power, they want to have their name slapped on a wall. So that in the future, maybe in the near future, they could be seen as, oh, this is George Weah Hospital he built. This is Joseph Boycott's ministry he built. That's not nation development. I think what it is here is when you see the need for something, do it. All right. Don't get me wrong. I'm not saying the military shouldn't have hospital. Okay. But at the point in time where our healthcare system were depleted, we're at a place where we think some may describe it as deplorable. Okay. But we still have faith in the institution. We still have faith in the people that go to work. We still have faith in the nurses, every staff that get up, that wakes up in the morning to go to JFK or every health facility in Liberia. We have faith in these people. They do it because they want to provide care. But if they were given the right equipment and the material, quality health care would be um, would be the number one. But they use every measure, everything they have at a disposal. But again, is that what they need? No. They need something that is going to provide quality care so that the reviews can be great. Look, I applaud these guys, okay? And Dr. Waller, I will keep saying this. Healthcare is a difficult, difficult kind of field to work in. You get in contact with people that you don't know. Okay, body fluids, a lot of stuff going on. So you are access for, or you could be a port of entry for spreading diseases to your family. So these people wake up and go to work knowing fully the life is at, you know, danger or at risk for contacting diseases from the hospital. But if these facility would do their best to minimize the transfer of disease from one person to another person, like sanitation, cleaning the hospital, making sure everything is done appropriately. I think funding plays a major role, but the number one thing here is management, like you said, management and accountability. Management and accountability. Are these guys being audited? Are things being done the way it should be done? Do we have quality management staff? Or do we just put people in there because of political affiliation? Then we're doing the wrong thing. Then we are doing the wrong thing. People who know about this facility management, healthcare, how it should work, and how they should make deliverables for the nation, for quality outcomes. These people are the ones that need to be running the healthcare system in Liberia. Not my nephew because of political affiliation, not someone who donated or gave me huge amount of money during my campaign. That's not what it should be. Healthcare should be a separate part of government where we look, the health of Liberians are very important. The future of this country depends on the younger generation, and the younger generation depend on the healthcare deliverable for quality care. Okay, and the education system in Liberia, the younger generation depend on the education system in Liberia to become future leader for that country tomorrow. But we are lacking in many capacity, in so many capacity. Don't know why, but we need to call it out. Let's call it out the way it should be. And again, look, Dr. Wallow, we have a serious problem in our country, and especially, I think I think JFK should be funded fully.
Yeah, look, I agree with you. You are making a good point. I'm not disagreeing with you. Okay. What I'm saying is that uh, the funding that you are advocating for JFK, if it is provided, nothing going to change. Nothing going to change, right? The USAID used to provide fund for JFK. Yes, JFK is still asking for money. How much would be enough for JFK? What would be that amount? the suggestion that Brian shared. Look, instead of giving that money to JFK, don't give it to JFK. The last time I said, look, if we Liberians in the diaspora want to help Liberians at home, that help is not in JFK. Okay, if we can contribute and say, okay, we want to contribute every month $10, create create a health care insurance. Okay, create a health care insurance. Take that money and put it in your healthcare insurance. Okay, let Liberians, just very minimum amount buy that healthcare insurance. Let a healthcare company that is established, when someone who has that healthcare insurance, like they go to places like JFK, demand that JFK, okay, we have our customers of our clients coming in your facility. We need you to improve your facility for us to send our patient to you. Improve your facility for us to send our patient to you, because we are paying you money for services. Do that to the other hospitals and hold them accountable that they improve their services. If they don't improve their services, send your client or your patient somewhere else.
But
And they will
uh,
improve their services. But to take that money and give it to JFK, I'm talking about if you really want to help Liberians, they just buy the health insurance, very little amount. That's the only thing they need to do. They buy it, and then you give them a health insurance card. When your child is sick, okay, this is the place we want you to go, and this is the facility we have. We have XYZ with, and tell that facility, you can go to that facility. You say, you know what, you need to improve your facility. Improve your services. Okay, we can get you some money ahead of time for you to improve your facility. But if you can't do that, then we're going to send our patients somewhere else. They need the customers. Okay, they need customers. They're going to improve. They're going to improve their healthcare delivery. They're going to improve the management. They're going to improve their services. I'm telling you. But you take that money, you give it to JFK. Okay, JFK are going to do whatever they want to do with it. Liberians will go there and they will be exorbitantly charged. What is the
so
dividend? Who are
yeah,
you
I mean,
helping?
but that's another aspect of looking at it. But if we would have to do something in media or something to transform the healthcare system, like especially at a national level, on where in the national hospitals should be transformed, and that could serve as income driven uh, um, process. Because let's say, for example, if we have specialists in Liberia, okay, specialized uh, in many different fields, okay, let's say we have somebody who know how to do orthopedic surgery, somebody who is specialized in seizure neurology. All right, now we have the specialty, then we have the facility well equipped. Okay, let's say Ghana may not have that service, and the final Liberia has that service. I can bet you will see a lot of people flying from Ghana to Liberia to come to Liberia for that service. You will see people coming from Ivory Coast flying for that service. But because we cannot provide these services, and it comes to a lot of money, and you
Yeah,
can
but
you
but,
can
but
even
see,
charge it. Uh,
CEO, you see, you are focusing on the equipments that we don't have. How about the ones that we have?
what do we have?
Whatever it is that is available, can Librarian afford it? Librarians can afford it.
No, they can't.
So
But
so
what I'm
so
saying,
if so but hold on. So if you put money in sophisticated stuff, that's good. But who is it for?
but you see, but this is my point I was coming at. Okay, just how to do it in the United States here. People have Medicaid, Medicare, and this that. Now, the citizen of Liberia should have access to healthcare. It may not be at 50% or 100%, but you have bare minimum access to healthcare, and that will come from the country national uh, um, healthcare system, not private system. Okay, so every born Liberians living in Liberia should have maybe 25% of access to healthcare. That is going to be paid by the Liberian government. So
Yeah,
again,
but
that's
but
where
but
they
see,
should go and find and seek help.
right. You yourself, you said it, that the system we are operating on is a
Pay
uh,
out of pocket.
pay out of pocket,
Yep,
right? That is what we are operating on. So the government is not providing, you know, healthcare uh, insurance for citizens. Okay, the government has government hospitals that's supposed to be at least affordable for citizens. I saw a video on Spoon, Redemption Hospital.
I saw it too.
You saw that, right?
Mm-hmm.
Redemption Hospital. They charge exorbitantly. If you don't get money, they let you die in front of their gate. A government hospital. That is those are the hospital you want for Liberians in the diaspora to fund. Who is it for? Who are you funding it for?
But again,
Because they're not going to change.
to the water, if the system is there saying that no national hospital in Liberia can refuse Liberians, they should be treated at a bare minimum for 25% of the cost. Then no hospital in Liberia under funded by the Liberian government should refuse a Liberian. You know what I'm saying?
I,
So
I, I agree with you.
if there is something
I agree
stipulated
with
in
you.
that like that, that's fine.
But the
But it's
media have
terrible.
reported that so many times as the government taking any actions. No,
But the
we don't
water,
value Liberian lives. That is the
you're
bottom
right.
line.
You're right.
CEO,
And,
we
and
don't
again,
value Liberian lives.
there
We
should be
wouldn't we wouldn't want them
statistics.
when we won't vote from them,
Yeah.
but we don't value our people's lives.
No, they don't.
If
I
Liberians
think
die, it's okay. Nothing wrong with it.
I think there should be statistics or maybe a reports from all federal hospital. Every hospital that is funded by the national government should make a report that is going to be public. Okay. Uh, maybe on the finance that's going to be internal document to be kept, but it should be displayed. We should understand how much redemption is bringing in a year to help the healthcare system, how much it's generating, how much FK is generating, but this information are not available to the public. Okay, now if we have a system that says, oh, this was going to be going to the federal hospitals, you know, and we expect this to happen, and every citizen here should get some kind of a treatment, at least stabilize them first. Stabilize them first. Okay, it shouldn't be a life-threatening issue, but stabilize them first, and then we can start making arrangement on how we can, you know, seek payment for these people. But you only have one group of people enjoying the country wealth, just government officials. They enjoy the country wealth. You're telling me that a single librarian in our country will not eat a dime from the librarian? I mean, from the resources? I think the wealth need to be shared. It need to be distributed. Even if you're making a deal with Firestone, Iron Ore, Gold, Diamond Mine, this, that. If we have 5 million plus people and you getting 6 billion a year on a contract for gold, and you getting 12 billion on the other side for iron ore, you getting 6 million on the side for the Firestone plantation. I think every Liberian, even if that $2 per citizen that you give them a month just for the natural resources, that's fine. Let them have the benefit of saying, I have eaten some of the benefit from a country God has given us. But you have just one set of people that sit over the government, sit on the country resources, do not care about developing the country, taking it to another level, but yet
So
enjoys all the benefit.
you don't even have to give librarians, you know, the physical cash. Just allow their children to go to school free.
Yeah, and pay for it. Yeah,
You know, just allow their children to go to school free. I'm not talking about just giving them substandard education. I'm talking about standard education. Allow their children to go to school free. We can even do that. Okay, we can even do that. Look, man, elaborate. For me, for me, the we need a lot of reform in our government,
yep,
in our governing system. Okay, and it would take a visionary leader to do that. But the things we are talking about, CEO, they are not rocket science. It does not need a rocket scientist, okay, to formulate solutions around these problems. These are problems that can be solved in no time. Okay, I'm not
sure,
saying that they are
sure.
easy. I'm talking about when we are committed to solving them, we can solve
Mhm.
them. We can make our country the envy of Africa because we used to be that before. Okay, we used to be that. So we can do that, but we need to Brian said the fear of God.
Yeah,
You know, we need to have people that have the fear of God, the fear of God. Because you put medicine in JFK, people take that medicine and put it in a private drugstores. You put medicine in redemption, they take the medicine and put it in a private, drugstore or clinics and stuff like that. We cannot continue to do that. Then people come and be crying for no money. Oh, the place is not funded. I can't buy that anymore. This thing has nothing to do with funding or money.
I,
It has
I
nothing
think
to do with that.
I think Liberia need a shake up, and that shake up, we don't care who is going to affect, but Liberia needs a shake up. We need somebody who understand what a country is and where we're going. Um, and we cannot keep our future leaders dumb forever. We need people that will come in and transform that country. We can keep having our grandparents, great grandparents running the country for 30, 40, 50 years. Um, they need to leave the country for the young people. Again, Dr. Waller, let's go on to the next topic. I know
Can we
you.
do it? Can we do it next week? At least we'll have the full team here.
That's fine. That's fine.
Yeah.
Yeah, that's
That's
fine. If you want, we can just close now and then we'll do that next week.
Yeah, at least next week we will have the full
Yeah,
team.
that's fine.
Yeah,
All
so
right.
I think this healthcare issue, CEO, is a very important issue for our country.
Mm.
For us to raise the standard of living and the longevity of life, we need to talk more about this. We need to develop, healthcare system that does not just treat people but prevent people from getting sick, right? We need to approach this issue from a holistic perspective, not just treatment but prevention.
Yes.
If we really put emphasis on the prevention part of it, it's going to bring a lot of relief to the healthcare system that we have in Liberia. Okay. And I think we need, hospitals, healthcare facilities, community organizations, community centers, they need clinics. They need to start to talk more about preventive care, than treatment. We need to put emphasis on that. I think that's
Yep.
going to help a lot.
Yes.
That is not our orientation, but we can begin to emphasize the
Yep.
importance of prevention. Then allowing yourself to get sick, because some of the things that we do, man, it just don't make sense.
Yeah.
You pee, you don't wash your hand, you go touch your food, you touch food that you sell to other people. When people get sick, then we are looking for witches, everywhere.
Yeah.
When you're not taking care of yourself, your health is your wealth. No, take care of that.
Yeah.
When you're sick, there is nothing else you can do. The big dreams you have, the vision you have for your life, whatever you want to do, when you're sick, you can't do any of that. So
Yep.
you need to focus on your health. We need to talk more about this, but
Okay.
the solution is not with JFK. There are 132 point something million that they want. That's not the solution for that.
All right, Dr. Waller. Closing statement.
I thought I just closed.
Oh, okay. I thought you were making a statement, but anyway,
No, I
cool.
will actually closing.
Okay. All right. So again, I just want to say thank you to our listeners and viewers. We say thank you for tuning in, and we appreciate you. Again, healthcare is very important, and I know it's a very big topic, but we're going to try our best to speak on the issues, and mainly we're going to be focusing on preventive measures, and also discussing what should be done and what are needed for healthcare to be at its quality performance in Liberia. Again, thank you for listening. Have a wonderful and blessed Sunday.